Good evening, and thank you for joining us for tonight's Musculoskeletal Health Australia webinar, Understanding and Managing Thumb Arthritis. My name is Helen Jentz, and I am a member of the Musculoskeletal Health Australia team. I would like to take this opportunity to acknowledge the traditional owners of all the lands from which we are joining the webinar this evening. Musculoskeletal Health Australia is bringing this webinar to you from the lands of the Eastern Kulin Nation, and we pay our respects to the Burrawong and Bunurong and Wurundjeri peoples as the traditional owners and custodians of these lands. We acknowledge and uphold the traditional owners' continuing relationship to the land and waterways, and we pay our respects to their elders past, present and emerging. Now, before we get started this evening, some housekeeping. We will have the chat open throughout the webinar and it is being monitored. Please feel free to put any questions or comments in the chat and we will endeavour to discuss them during the Q&A part of the session. Also, if this evening's webinar raises any questions or concerns, please make sure you call the Musculoskeletal Helpline on 1800 263 265 to speak with our highly qualified healthcare professionals. Tonight's webinar, it's all hands on deck, or more specifically, it's a huge thumbs up to understanding osteoarthritis and how it impacts our hands. We are very fortunate to be joined this evening by Ms Jessica Cauchi, who is an occupational therapist and an Australian Hand Therapy Association accredited hand therapist and a clinical director at Melbourne Hand Rehab. Jessica has a passion for providing client-centred holistic care that is evidence-based. She works with and educates clients about how to best manage their hand injuries and conditions to enable them to reach their identified goals. Jessica has a special interest in treating clients who have osteoarthritis and assisting in ways to maintain their function and participation in tasks they love to do. So it's time to put our hands together and welcome Jessica.
Thank you for that introduction, Helen. Welcome everyone to today's session. We're going to go through some information, and as Helen said, I do welcome any questions, so please place them in the comment section and we can go through them at the question time at the end. So, what is arthritis? Now, arthritis is a big umbrella term and it's an informal way of referring to joint pain or joint inflammation, and it's any joint in particular. Obviously we're going to focus on some particular joints, but it could be your thumb, it could be your finger joints, your knuckles or wrists, and they can all be affected by arthritis. And as I said, arthritis is this big umbrella term, and we have different types of arthritis that can affect your hands and joints, and they can cause pain, swelling and decreased range of movement. And these symptoms can really fluctuate and be present in a certain degree, and that's usually classed as mild, moderate, or severe. With arthritis, one of the most common types is osteoarthritis, and this is a degenerative type of arthritis. In a normal joint, which we can see on the left X-ray, we have nice beautiful cartilage that layers between the end of each bone. We've got nice space in between those bones, and that allows minimal irritation of the little nerves that feed back information back to our brain. The cartilage that is on the end of each of those bones, that helps the joint move nice and smoothly and cushions, it gives a cushion to those ends. And if that cartilage breaks down and becomes thin, which often happens with osteoarthritis, the joint loses that nice clean space and its ability to move smoothly, resulting in that osteoarthritis that we see. Now, osteoarthritis mainly affects people over the age of 45, but it definitely can develop in younger people. And the scenarios where we would see this if someone has had a traumatic injury and we've had some osteoarthritis develop. And again, there's different types of arthritis, including but not limited to juvenile arthritis, which could affect the younger population as well. So jumping to the x-rays that we see on the side, as I mentioned, that left side is a nice healthy hand. We can see those nice clean lines in between those bones. And then that right side is obviously a hand which has arthritis at the MCP, PIP, J, and DIP joints, and also the carpometacarpal joints as well. So if you do have arthritis, often clients are not quite sure of what their symptoms and whether they're directly related to be having osteoarthritis. So most people will commonly experience pain, swelling, stiffness through the joints, and that's something that frequently happens. They may also experience pain with pinching activities, especially if you have pain and arthritis at that carpometacarpal joint, so that's that joint just there. That is the most common joint that we see osteoarthritis in. People who do have arthritis at that joint will often notice that they have a funny little bump that comes out through the base of their thumb. As I said, they might have some pain with pinching activities. They might also notice that there's some rounding at the different joints. And again, that's because of those changes at the joints that we've spoken about before. The next sort of arthritis that we see is rheumatoid arthritis. And rheumatoid arthritis is an autoimmune disorder where our body mistakenly attacks that nice tissue within those joints. Now, this is a systemic condition. So the changes that we see on one side of the hand or the thumb is going to be seen again on a contralateral side because it is a systemic condition. Rheumatoid arthritis will cause inflammation of the joint capsule and the lining, and it will cause quite a bit of painful swelling that can result in the bone deteriorating and the joint deforming. People with rheumatoid arthritis will often experience the sore, swollen joints, the stiffness if they're not quite moving their fingers, and they often might report some heat or like heat to touch that painful joint as well. And it's definitely not limited to the hand. As I said, it's a systemic. So if we're seeing changes to one other joint, for example, your knee or foot joint, we're going to see that to the other side. And again, not just the hand as well. So often I get asked is, one of the common questions I get asked is, why do the joints ache and why are they causing pain? And the reason that happens is because of the inflammation at the joint. In between that joint, there's a nice little nerve or quite a few nerves that sit, and they feed back information to your brain. When we have a nice healthy joint where nothing is rubbing on those nerves, we don't have pain. But when we do have inflammation and we do have those joint ends rubbing on those nerves, they irritate it, and then we then in turn have pain. In addition to this, when our joints become stiff, our muscles that are pulling on those joints to create the movement, they actually have to work harder to produce the same response that we want. And they in turn become quite tired quite quickly, again, causing some pain or some overuse symptoms where we might see some tendinopathies in our muscles. In severe cases, where we can see that there's bone-on-bone contact, that cartilage again wears away, causing further irritation and further pain at that joint. So what I would really like everyone to go home with tonight is how we can really help, how hand therapy can help arthritis. Because it's often unfortunate that I do get patients coming into the clinic saying, I've been diagnosed with arthritis, there's not much I can do now. And it's a lot of misinformation. So we're going to go through some strategies of ways that we can help with arthritis and help manage arthritis. We know that we are not going to cure arthritis. It is a degenerative condition. So our goal is to either splint or protect the joint or work on stability. And then we maintain all those gains that we've achieved in hand therapy, and we continue to monitor that. So we'll talk a little bit about that now. One of the things that we definitely see in the evidence and clinically that helps a lot of patients get good pain relief and comfort is wearing splints, gloves, or finger sleeves. And these supports can provide support to the joints when we complete everyday activities like cooking or doing washing or gardening. They can provide warmth and pain relief at the joints. They can allow resting at the joints. So when we pop on a custom thermoplastic splint or an off-the-shelf splint, we actually immobilize that joint. So it's not moving, so that rubbing on those nerves is not happening, reducing that inflammation. We can also, with the splints, prevent overloading and further joint damage. And in some cases, we can correct deformities that occur as a result of having arthritis. There are different splints and support options available. And when you come in to see a hand therapist, you will chat to your hand therapist and explore the appropriate options. The priorities for splinting is that we look at the joint that's affected, the levels of pain that you're experiencing, the levels of support needed. We consider the cost, and we consider the activities of daily living that you will be using this splint for. So there's no one splint that fits all. We custom prescribe and fabricate, if that's necessary, to your joint that's impacted by the osteoarthritis. So this slide shows a range of different splinting techniques, and we're going to go through that now. So on the top right, we have a finger sleeve. Now, this is a custom neoprene sleeve that we fabricate in our clinic. So this is often if you have arthritis at the DIP joint or PIP joint of your finger. And rather than wearing the gloves, this helps compress and keep those joints nice and warm. The next slide is the arthritis gloves. Now, these are two versions of the arthritis gloves. The black version is called a thermoskin glove. Now, you'll see there's funny properties on that glove that actually retain the heat of the hand. So patients will often wear these on the colder winter mornings or the colder days of winter, and it will retain the heat of the hand. So if you find that's an issue for you, that might be an option. The next option is the grey the grey arthritic gloves. And these give some nice compression as well. They do give some maintenance of the heat as well, but not as much as those thermoskin gloves. So that might be something you guys can consider. The next splint that's on the side is a push thumb CMC joint brace. So this is if you have arthritis at that thumb joint that we were talking about. This is an off-the-shelf splint, and this might be something that we transition to after we give a patient a thermoplastic splint, which is our red splint on the bottom corner of the slide. So that is a custom splint that we fabricate to your hand, and it immobilizes that CMC joint. What I mean by immobilizes is we stop moving it to reduce that inflammation. And then the slide next to that is a thumb and wrist immobilization splint. And this can be used for arthritis we might see in the wrist joints. Again, a common arthritis we see is at the STT joint. So right in through that top wrist joint in through here. And this is something that we can use for that as well. So again, there's quite a few different options. Your hand therapist will discuss the wearing regime. So some of these splints you might start wearing off full time, and what that would look like is you're wearing it 24 hours a day, only taking the splint off for some hygiene. Some of these splints are waterproof, so those bottom two splints, the red and white one, they are waterproof. So you can wear it in the shower, you can wear it at hydro or when you're in the swimming pool. And after you've wet your hand, you slide the splint off, wipe your hand, and then pop the splint back on. The top ones, as they said, these are a little bit more to address your needs. So you might just wear it in the colder weather, or you might just wear it for an aggravating task like chopping veggies or opening up a door with keys. And this is something that's discussed with your therapist. Initially, we wear the splints off splints as much as possible, so we allow resting at those joints, and then later you wear them depending on the activities you're performing to avoid the over-reliance of that joint and prevent muscles from weakening. Sleeping is a fantastic opportunity to wear splints because it really allows the adequate rest of that joint. So these are some of the splints that we can trial with you. The next modality that is so fantastic is warmth. And this can include warmth from a heat pack. We at the clinic use paraffin wax bath. Now, paraffin increases the joint heat by 4 degrees and the muscle heat by 7 degrees. So it warms everything up and loosens those tight muscles and those stiff joints. It soothes the achiness that you have that's related to the arthritis at the joint. And due to the heat improving the circulation at that site, it delivers all these lovely nutrients to the joints and muscles, again, relaxing those stiff muscles and joints. It's really good to use when we prepare for activities around the home or completing your exercises. So when you're in the clinic, we'll get you into the paraffin wax and then do your exercise prescription and help with that. Obviously, not everyone has paraffin wax baths at home, so we talk about use of wheat bags and the thermoskin gloves that we talked about as well. Some patients also like the benefit of some cold treatment. So that's when we get ice packs, and that's beneficial for that acute inflammatory pain and swelling that clients may experience from overusing their hand or having an acute injury. Because cold temperature restricts the blood vessels and slows down the circulation, it will reduce that inflammation. So again, it might be something that we use initially, and then we might transition to warmth as well. And this is something you can discuss with your hand therapist too. The third thing that we do to manage osteoarthritis is joint protection. So pain is a real indicator that you have done way too much and your joints are overloaded and they're groaning and saying, you need to back off using me. I'm in too much pain. And there are really simple ways that we can protect our joints and reduce the strain that we pop on them and prevent flare up of your pain, of your arthritic pain, and improve again how you function each day. So we're going to go through some basic principles that you can apply to your everyday tasks, and that's really to protect these joints and make sure that you are conserving your energy and conserving your function so you can really participate in those activities you want to. The first tip is we want to avoid heavy loads through small joints. So we want to try and use our whole hand to grasp objects instead of your thumb. We want to use items where we can build up the grip. So rather than having a small grip, for example, when we're trying to push out a pill, we could use something like a pill popper. Or rather than trying to, again, hold the pill and cut it to split it, we can use a pill splitter. Again, we can use larger built-up grips like the key turner, or even a pencil grip for when we're using a pencil to write. Another thing is using aids and equipment to help loosen and lessen the load. So we have the top right-hand corner is a kettle tipper, and this is so our patients are actually not having to lift up the kettle and then manipulate the kettle. Rather, they just have to hold onto the grip and tip that kettle with as much water as they like. In the middle of that, to the right of that photo, there is a tap turner. So that is placed on the tap, again, building up the grip, and then you have a lever that you can push and pull. Again, to the right of that is a non-slip mat. So often we have a lot of patients who will come in and say, I really struggle with opening jars. And this is an option that you can use. The bottom corner also shows a jar turner as well. Now, there are fantastic different ergonomic equipment. You can get, I guess, an 8-function jar turner that has different functions that you can use, and one of those is opening up the jar, a jar, opening up the can, placing it around a water bottle to open up a water bottle lid. Another tool is the long and large handled knives. This is a very small example of all the different equipment that you can get. I recommend, if this is something you're interested in, that you visit the Independent Living Centre Australia website, and that's on the screen. This is a fantastic website that has a range of equipment. You can search what you're looking for, and it will have different options that you can review. In our clinics, we also have these pieces of equipment as well. So this is something you can trial, and your hand therapist can talk you through as well. Another tip is that we want to spread the load that we place through to our larger joints where possible. So for example, our wrist and elbow joint. So rather than, for example, holding something through our hand, feeding it through the handle, like feed the handles through the forearm or over the shoulder and not just in the fingers. We want to avoid carrying things that require a firm grip, like a saucepan. And if you must do that, we want to make sure that you carry it with your palm, with the palms of your hand rather than the fingers. I do this even though I don't have arthritis, just sliding things across the bench rather than having that full grip, or even placing them on a hostess trolley to carry items around the house. That's a fantastic option as well. When we think about arthritis and think about the level of energy that you have, we want to think about conserving your energy. So we want to take shortcuts where possible. And that might look like getting some pre-cut veggies or a pre-organized salad. We want to plan our day and plan our week. So rather than cleaning the house every day, we want to think at the start of the week when we're going to allocate the vacuuming, the laundry, the mopping, and prioritize which tasks absolutely have to be done. So which are those urgent tasks, and leave the other ones that can wait for later. We want to break tasks into smaller components. And for example, when you're doing your meal prep, we could start the morning by just cutting the vegetables, having a break and going to some other task, then coming back at midday and popping things in a pot, and then at the end, finally making the meal. So breaking it across the day or the week, for example, with cleaning, or the month with gardening. So we're not doing all the tasks in one day where we're causing a flare-up for our hands, and then you're not able to engage in those activities you really love to engage in. Another strategy is using electrical appliances where possible. So rather than chopping your nuts, you could pop them in a food processor, using a can opener, an electric knife, so you're not having to push and pull, rather the knife's actually doing the work. So what we'll do now is we're going to go through some gentle exercises. And these exercises are some of the exercises that your hand therapist might prescribe. These are based on the most newfound evidence for osteoarthritis. And what it shows is that regular exercise and massage is important in reducing stiffness, keeping your joints and muscles working, and maintaining strength in your hands, in particular your thumb as well. So with regard to massage, the thumb web space in through here, this muscle tends to tighten up when your thumb is less stable due to arthritis at the base of your thumb. And tightening in that web space can really restrict the flexibility and movement in your thumb. So in order to loosen and lengthen this tight muscle around the thumb, what your therapist will prescribe is actually releasing that muscle. So just giving it a nice pinch, okay? For those clients who have arthritis in their thumbs, that pinch might be a little bit uncomfortable. So what you can do is just grab a laundry peg and place it in through there. And I suggest that you hold that peg for about a minute. So that will start to release that muscle. And this is something you can do as often as you like. So you want to make sure that you're releasing it as often as possible, just so we start to loosen and lengthen that muscle. With regard to the exercises, we don't want our clients to be afraid of their hands because they have arthritis. Regular exercise is really important to reduce that stiffness and keep your joints and muscle working. So when you come in and see a hand therapist, it will look like you having a program that we upgrade on a weekly basis, and then we will start to transition you to fortnightly and monthly and then bi-monthly appointments so we can monitor this. One of the exercises that you will do is on the screen, and this exercise is called a hook. And this is really working on your proximal joints, your PIP joints, and your distal DIP joints. It is also working on your thumb, MCP, and IPJ. So what you're doing in this exercise is you're creating what we call a hook. So it looks like that. Often when you start this exercise, you may only be able to get to a certain point, and that's okay. As you practice this exercise, you're going to notice that you get a little bit more flexion as you go. What you do with this exercise is straightening out your fingers and thumb and just bending those top two joints, again, creating that hook shape. And I suggest you just hold that for about 3 seconds and then come back into extension. And we typically suggest you doing this 3 times a day and 10 repetitions as you do that exercise. The next exercise is working on your opposition of your thumb. So opposition is such a fantastic and important skill because that's a skill we use when we hold a pencil, when we pick up objects. So this is something we like to work on. The exercise being that you might touch the tip of your thumb to each of your finger. Now, when you do this, often patients will have a bit of a D shape because they've got that tight muscle in through there, or the joint's not sitting quite properly. So we want to make sure that we're making a nice circle with that, okay? So at the start of this exercise, you might only be able to make a circle to your index and your middle finger. And as you progress, we'll slowly get you down all the way to your little finger. A progression of this exercise is then sliding that thumb down as we go, so we can slowly get all the way down to that crease over here. Another exercise is working on that FDI muscle that gets nice and tight. So in addition to releasing that muscle and lengthening it, we can place our hand flat on the table and stretch that thumb sideways away from the thumb, and then move your thumb back to touch the side of your index finger. Again, another exercise that you can do for thumb away. An additional exercise is having your hand sitting on the side of the table and stretching your thumb away from your palm so you can make a C shape, okay? And this is the lovely position that we would use when we're holding a cup. Okay, so nice and functional. And you can do this with a cup in hand if you feel you need that extra support. In addition to these range of motion exercises prescribed by your treating hand therapist will also focus on establishing the muscular stability for the arthritic joint. And we target the extensor muscles and offload the flexor muscles involved in pinching. So they're quite tailored exercises. We want to concentrate on static stability of the joint, and then further down the track, concentrating on your dynamic stability of the joint. And these exercises should be completed when your pain levels have reduced, because we do not want to cause an inflammatory response at the joint. So they're really targeted. They're prescribed by your therapist to retrain your thumb and use force and distribute that force so it's not just going through that arthritic joint. Ways that we can do this are through elastic bands, TheraBuddy, tennis balls, and we'll go through that a little bit later. But ways that we assess this are through dynamometers, which are on the screen. So the one that the patient is gripping, which is on the right side of the screen, that is for your hand strength. Now we will take your hand strength and we will compare it to the norms based on your gender and your age. We will also compare it to the contralateral side. So if you are right hand dominant, we would expect it to be about 10% higher than the left. So we assess that and compare that and understand where you should be, because that will be how we guide our exercises. Now, the next photo with the thumb pinch, we are looking at your thumb pinch and your ability to complete a lateral pinch. So we will test the different pinches. That lateral pinch is something that we use when we're opening keys indoors or when we're gripping something like a water bottle lid. We'll also look at your tripod grip, and that's the grip that we often use when we're picking up objects. So we'll have a look at your strength and we'll again prescribe you exercises depending on which strength is not quite right and not up to standard. One of the exercises that we do is with an elastic band. So in this exercise, we place the elastic band around your index and middle finger, and we slide that index finger out to the side, stretching that elastic band. Now you can decide how much resistance you want by looping the band around once or twice. And when you do that, you want to hold for about 3 seconds. So we want to load the muscle up and get it ready, and then slowly relax the fingers together. Another exercise is holding a tennis ball in your hand. Now there's a few different ways that we can transition this. The first way is just gripping a tennis ball and getting that nice position and activating all those muscles that we want to activate. Then we can increase by holding the tennis ball and squeezing that ball, almost making like little bunny ears. Then we can place elastic bands around that and gradually progress you. And we show this in the next slide. So placing the elastic band around the ball, giving the ball a squeeze, and then trying to lift up the index finger. So we're solely activating those muscles that support that thumb joint. So that is our presentation for today. I would love to open up the floor for some questions. I can see that there's some in the chat.
There are a couple in the chat, Jessica. So Annette asked the question, she's been diagnosed with OA in every joint, including the neck and spine. Do you have any recommendations?
Yeah, so Hand therapists specialize from shoulder down. So we do shoulder, elbow, wrist, thumb, and fingers. But this is a very common question we get. And often my answer is I would recommend that you actually go see a neck physiotherapist who specializes in that area of the body. There are a lot, just like the principles that we've talked about, for example, massage, exercise, heat. A lot of those principles can apply to osteoarthritis at other joints. But again, I would suggest that you get firstly assessed by a physiotherapist who concentrates on that, and then you can start to implement some of those strategies as well.
Great. Louis asked a really interesting question. Why do hands stiffen overnight whilst sleeping?
Yeah, that's a really, really good question. So often when we're sleeping, we tend to go into an innate physiological position. So we tend to clench those fingers, and sometimes we don't move them. So that fluid in that joint, it doesn't really move around. And I like to liken it to one of those old kind of concrete mixers. So when we're using our hand, that's when the concrete's slishing around and it's nice and wet and moist. But when we stop moving it, everything starts to harden up, which is why in the morning we can often, especially if you do have osteoarthritis, we will often wake up with those stiff joints. So a strategy that I would suggest managing that is do some of the exercises your hand therapist has prescribed, get your hand into some warmth, and that could be popping your hands under a wheat bag, getting into a warm shower, running your hands under some warm water, and just start moving them. So we want to start that concrete mixer again and start to lubricate those joints. Does that answer your question?
I think that's a great answer, Jessica. Now, here's an interesting one, and I'm not sure whether you will be able to answer it. But the question was, are any of these therapies also useful for, now I'm probably going to say this incorrectly.
That's okay. Yeah, I know what it is. Do you want me to pronounce it?
Yes, please.
Yeah. So the question was, are any of these therapies also useful for Dupuytren contractures? So Dupuytren contractures are a different condition than osteoarthritis, but I'm definitely happy to answer this question. That's when we see our flexor cord tighten and we develop a cord. And what the evidence shows is Dupuytren contractures need to be managed through surgery. Now, we often get patients come in and I can see they've got a Dupuytren cord. And what we can do is we do take measurements, and if it's appropriate, we will refer to a surgeon. So you could do some of these exercises to help with movement, but it's not going to delay the progression of a Dupuytren cord or a contracture.
Fantastic. Now, here's one from Rhoda, who's a massage therapist. And she's raised that a number of her clients come in with very arthritic hands.
Yeah.
And she's curious as to whether massaging them will either help or will it cause a flare-up and cause more pain?
Yeah, so it depends what muscles you are massaging and what joint has arthritis. We do massage as well as hand therapists, and sometimes it is very helpful. We just need to understand at what point are they in their cycle? Are they having an inflammatory response, or is it in the maintenance phase? But yes, it can be helpful. We just need to understand and appreciate what muscles we actually want to massage and work on, and go from there.
Okay, so you mentioned the use of certain tools throughout your presentation. The question is, where do you find our handheld dynamometer comparison measurements?
Yeah. So do you mean, with regard to that question, do you mean where do you find the actual dynamometer, or where do you find the comparison for your age and gender?
Let's answer both.
Okay, all right. So with regard to the dynamometers, we order them, and they're quite costly. So we have them at each of our clinics. And that's something I get my patients to do in each of their appointments, because I want to make sure that what we're doing in therapy is obviously helping them and beneficial to them. So that's to answer the first part of the question. The comparison measurements are all online. You want to make sure that you're looking at the Australian norms. So you can just Google that, okay? And it will typically take you to the Australian Health Information website, and you can get that data off there.
Fantastic. Now, another question that's come up in the chat, and this is, I suppose, very interesting from the complementary and alternative medicine perspective. Does turmeric help?
Yeah, that is such a great question. Thank you for asking that. It's definitely a question that we get quite a bit. Now, we know that turmeric has properties to reduce inflammation. So yes, this is something that we always encourage our patients to have a chat to their GP or their dietitian or their pharmacist about getting some turmeric supplements. Because we are hand therapists, this is not something we can say, yes, go get some medicine over the counter, because that's not within our scope of practice. But we definitely identify that it does reduce inflammation. So we encourage all our patients to have those conversations with their GP. With any supplement, often our patients will come in with a lot of other comorbidities and they'll be on other medications. So you want to make sure that if you're taking any supplements, it's not going to interact negatively with any medication you are taking. So that's, again, something you just have a chat with your pharmacist or your GP about.
Yeah, and that's a really good point, Jessica, is talk to your pharmacist as well, because their knowledge in terms of how various complementary medicines and supplements and vitamins interact with prescribed medications is really a source of knowledge for patients and consumers. So that's a really good point. On that, I want to ask a question around, so you've been diagnosed by your GP, and we know that GPs have a certain, toolkit when they make these diagnoses, and they've put their patient on anti-inflammatories. What does the patient do now?
Yeah, that's a great question. A lot of my patients will come in and say, okay, well, I've been diagnosed with osteoarthritis, but I've been told there's nothing I can do. And it's, as you can see with this presentation, it's it can't be further from the truth. So if you do have some anti-inflammatories, we will do a thorough assessment, because we want to make sure what type of arthritis it is, where it is, how it's impacting your life, and what goals we need to address to get you back to that. Once we've done a thorough assessment, we will have a look at whether you need a splint or an off-the-shelf cast or a neoprene sleeve, and we will fabricate that in the session. So you will walk away with something like that if that is what you need. We do not just kind of send off splints willy-nilly. It is something that we will prescribe and recommend to you. Once you have that splint, then we get you back in to get you into the paraffin wax. We will start some muscle release and massage, and we will get you into an exercise program. So what your program would look like is, for the first couple of weeks, we're seeing you on a weekly basis to reduce that inflammation, get that pain down, get any swelling down. And then we are monitoring that and giving you strength and range exercises to get your range of movement, your strength back to normal, your function back to normal, where we will start to wean the splint and then think about strategies of how to maintain all these fantastic gains in your therapy. So that's what it would look like. I guess to come back to your question is, we wouldn't always encourage you to stay on anti-inflammatories, and this is something we have joint conversations with your GP and yourself about, because some patients don't like to stay on anti-inflammatories, and they don't like the effect that it has on the tummy. So in your initial appointment with any of the hand therapists at Melbourne Hand Rehab, we will send a letter back to your GP and say, this is what we've done in the appointment, this is what we plan to do. And we will continually give updates to your GP, so you can go back and say, okay, well, the splint's really working, that's helping manage my pain, so I probably can come off this medication, or we can wean that down, whatever it might be. It's always a conversation amongst all your health professionals, not just your GP involved, because we want to make sure we're supporting whatever your goal is. And if that's to come off anti-inflammatories, that we can support that too.
And Jess, that leads on to a really good question from Bernadette.
Mm-hmm.
The question is, where do we find a hand therapist if you need an assessment? And the follow-up to that, do you need a GP referral?
Yeah. So to answer the second question, no, you do not need a GP referral. In Melbourne, Melbourne Hand Rehab has nearly over 12 clinics. So we have got locations all across Melbourne. You can book online, you can give us a call. Either options are available to book in. If you are not in Melbourne, what I would suggest is that you go on the AHTA website to find a hand therapist, and you will find renowned accredited hand therapists who you can book in and see.
So just for everyone's reference, AHTA stands for the Australian Hand Therapy Association. So if you pop that in Google, that will come up. And as Jessica said, it will have a list of accredited hand therapists in every state and territory. So I wanted to, there's been a couple of similar questions in the Q&A around whether these strategies and these exercises that you've been mentioning tonight are good for preventative purposes. Like, can these exercises at least slow down, further deterioration, or, stop incidents of inflammation and stiffening? And then I think the follow-up to that question, Jessica, is, one of our attendees said, should we just push through the pain if we know that by doing this, it's going to have a positive outcome in terms of prevention or slowing down the deterioration?
Yeah. Great questions. To answer the second part of the question, and then I'll come back to the top. I don't believe it's a quality of life to push through or have this pain day in and day out, and for that pain to impact on things that you love to do. They can be as simple as crocheting or sewing, or even playing with your grandchildren or doing your grandchild's nappy. I don't think I won't accept for my patients them living in pain. With regard to osteoarthritis, it is a degenerative condition. So doing all these management strategies, we hope to get you to a point where your pain has come down, your strength has gone up, your range of movement and function have gone up, and then it's about maintenance. With regard to prevention, doing that program prevents you from having that big spike of inflammation, because we've got all these strategies in place where we're not exacerbating the joint, and we're not using it in a way that's causing inflammation. Does that answer the question, Helen?
It absolutely does, Jessica.
Yep.
Now, I'm a bit reticent to ask this question because I have these terrible visions of people on TikTok showing how to do this and people ending up injured. But there was a question around, how do we make a paraffin bath at home? Yeah.
I always get that question because it's actually quite simple. So you can order these paraffin baths. They are expensive. I think the ones that we have in our clinic are up of like $300. You can buy them online. There's much cheaper versions of them. And then some of my patients have those versions, and we just sell them the paraffin wax. So they just come in and get their box for the month. In the clinic, what we do is once you've popped your hand in the wax and you have your wax mold, we chuck that away, obviously, because of hygienic purposes. But if you're the only one using that wax, we just have our, like at home, you can just pop that wax back in, and it usually lasts for a couple of months. So you can find anything on Google. If you would like to purchase the wax baths that we have at the clinic, we do sell them as well. That's an option as well.
Fantastic.
Yeah.
All right. There's been a fair bit of chat also going on some comments about significant. Gail mentioned that she's seen significant improvement in thumb strength and stability using the tennis ball and rubber bands and advanced exercise. And the exercise has definitely slowed, if not stopped, the deterioration. So that's really, really good. Megan has asked that a specialist surgeon has recommended surgery on the thumb joint. Now, I recognise you can't give medical advice, but you know, where surgery has been recommended, what's your sort of views on that in terms of the patients you've dealt with?
Yeah. So my, I guess, suggestion and stance is that I would always have a trial of conservative management. And if it was, you know, I'm not going to give advice because I'm not sure how severe your thumb joint is to have necessitated a referral for surgery. But with osteoarthritis, I always like to do a conservative management approach. So that might be that we trial splinting for a couple of weeks, start some program. If we're not seeing results, then you've not lost much from that input. And if it hasn't worked, you go back to the surgeon and we'll write a letter to the surgeon saying this is what we've tried, hasn't been successful, let's do the operation. But I always suggest that, you know, if you are going to go down a surgery, you know, you want to make sure you've tried everything else before that. So it might be the fact that you just get an appointment with a hand therapist, you trial some of these suggestions. If they work, that's fantastic. We can maintain that. If not, then we can facilitate you going down the surgery pathway.
Fantastic. Now, final question for the evening. I'm hoping I already know the answer to this, but the question was, can you use soy wax, or do you have to use paraffin wax?
I don't know the answer to that question. To be honest, we use paraffin wax. I'm not sure whether you can use soy wax. I'd be concerned of it burning. So we use paraffin wax. I'm not sure if you can use soy wax.
Excellent. All right, Jessica, I think you just have to look at some of the comments in the chat to note how much your presentation has meant to everyone online this evening. We had over 100 people attending this evening's webinar, and the commentary is how inspiring and helpful it has been. So on behalf of Musculoskeletal Health Australia and all of our attendees, thank you so much for a wonderful webinar, and we wish you all the best for the rest of the evening, and we'll see everyone again soon for our next consumer webinar coming up in May. Thanks for joining us, Jessica.
Thank you so much, everyone. I hope you have a lovely evening.